Okay. Today's topic is Uchiraria bankruptcy. Uchiraria bankruptcy. Uchiraria bankruptcy is called as filarial worm. Uchiraria bankruptcy is called filarial worm. So now helminths or nematodes or roundworms are classified depending on those who are in the intestine and those who are on the visceral side. These are extraintestinal, visceral nematodes. Intestine, I said the best mnemonic is yeast. One is enterobius, enterobius vermicularis. It is pinworm, seedworm, threadworm. What is it? Pinworm, seedworm, threadworm. It is oviviviparous or viviparous. The moment it hatches egg, it will be turned into worm, and most of the time it occurs in children. So, so from anal to auto infection. It gives rise to perianal itching, and it is done by NIH swab, cellophane tube, NIH swab. It is in children, okay, common in children. Next is ankylostoma duodenale. Ankylostoma duodenale, Necator americanus. And Strongyloides turpialis. These are the most of these worms get man into infected walking barefoot. Filariform larva is the infective stage. Filariform larva is the infective stage. They go to from Venus, they go to the lungs. They go to the lungs and comes to the intestine. They comes to the intestine and where develop into male and female adult worm. They give rise to iron deficiency. They give rise to iron deficiency anemia. They give rise to iron deficiency anemia. They give rise to iron deficiency. All three. They give rise to iron deficiency anemia. So everybody repeat with me. All three hookworms, Ankylostoma duodenale, Necator americanus, Strongyloides turcularis. All of them enter the man when he walks barefoot on fecally contaminated soil. Through veins, they go to the lungs, they creep up trachea and via esophagus, they come and in the intestine, where they develop male and female adult worm. They suck the blood and give rise to iron deficiency anemia. Lab diagnosis is demonstration of egg. It has got non-bile stained egg, non-bile stained egg. By non-bile stained egg, it contains 4 blastomeres. How many? 4. 4 blastomeres. And here this egg is plano-convex, non-bile stained. Entropes vermicularis is plano-convex, non-bile stained. Here it is non-bile stained. Inside you have 4 blastomere. Inside you have how many? 4. 4 blastomeres. 4 blastomeres. Then here again trichuris, trichura and trichinella, paralysis. Trichuris trichura is called as whipworm. Trichuris trichura is called as whipworm because the posterior end is thick. The posterior end is thick. The anterior end is thin. And in common man it is called as, common man's term, it is called as whipworm. Whipworm. And the egg is bile stained, barrel shaped, with mucus plug at the both ends. Man get infected by eggs, fecal-oral route. It's in the intestine. Okay. How many you have? 1, 2, 3, 4, 5, 6, and 7th one is, of course, Ascaris lumbricoides. Ascaris lumbricoides. Trichinus trichura is called as trichina worm. What worm? Trichina worm. It's a pork. Man get infected by uncooked pork, and it gets encysted in the muscle mass. It gets cooked in the muscle mass. Man is the most probably dead end host. Man is the most. Ascaris lumbricoides is one is the unembryonated egg is elliptical in shape, whereas embryonated egg is round and it has got a lamellation, and inside you have an embryo. It is bile stained. Okay. Man get infected by fecal-oral route, and in the intestine they do not develop into male and female worm. They go to lungs and again come back to the intestine. They go to the lungs and again come back to the intestine. and where they develop into male and female worm, and they give rise to malabsorption of the nutrition and like kwashiorkor, marasmus, and all this. So this is a story of intestinal nematodes. How many are there? 7. Okay, can you repeat with me? 3 hookworms. Ankylostomata duodenale, Necator americanus, Strongyloides circularis. Man get infected by walking barefoot on the fecally contaminated soil. Through veins, they go to the lungs, come back to the intestine, and intestine they stay and give rise to uh, iron deficiency anemia. They suck the blood. Okay. Next is Enterobase vermicularis. It's commonly seen in children. Auto-infection from anus to the oral cavity. And diagnosis by NIH swab. And, the eggs are plano-convex, non-bile stain. Plano-convex. Then Trichuris trichura is bile stain. It's called hookworm. Posterior end thick and anterior end thin. Man get infected by consumption of eggs. Eggs are barrel shaped with bile stain with mucus blood at the both ends. Okay, it is in the intestine. Trichuris trichura by uncooked pork, partially cooked uncooked pork. Man get infected by consumption of food and water contaminated eggs. Rondo Mescaris lumbricoides. Man get infected again consumption of eggs, embryonated eggs. They do not develop into adult worm in the intestine. They go to the lung and come back to the intestine where they develop into male and female adverb. That is the pakka. You are sure about. So this is about intestinal nematodes. These are intestinal nematodes. So Ucheraria bankrupti is also called filarial worm. Ucheraria bankrupti is also called as filarial worm. Filarial worm. Life cycle takes between man and mosquito. Man get infected by third stage larva by mosquito bite. So they are present in the lymph nodes and lymphatics. They are present in the lymph nodes and lymphatics. The larval form is called as microfilaria. There are 3 microfilaria which are sheathed. Remember cricket yesterday we won the match against Pakistan in the penultimate ball and Hardik Pandya hit sixer. So you remember sheathed microfilaria, you remember with mnemonic. Sheathed microfilaria, you remember LBW, leg before wicket. So loaLoa, Burjia Malayi, and Lucia bancroft. Burjia Malayi and bankrupti similar. They cause filariasis. loaLoa goes to eye and causes, is also called as blinding worm. It is also called as blinding worm. So they give rise to lymphangitis and lymphadenitis, and all the drainage of lymph is backed, and legs get swollen, and it's got a name called as elephantiasis. Elephantiasis. Man's leg look like a elephant leg. Man's leg look like an elephant leg. Usually, which occurs in the this is transmitted by Culex mosquito. Culex. Culex mosquito. The mosquito get infected by sucking the blood of man, which contains microfilaria is infected to microfilaria is infected to the mosquito. Microfilaria is infected to the mosquito. Now, it causes elephantiasis, lymphadenitis, and swollen leg, elephantiasis. Looks like an elephantia. So how do you do diagnosis? You have to do the peripheral smear, do Leishman stain, and you can demonstrate microfilaria. And usually they come out in the night, usually around 12 o'clock in the night. They are nocturnal in habitat. So you are asked to take, go to the lab ward and take the smear at midnight. So we treat this microfilaria. To kill this anti-microfilaria drug is Hetrazan. The the name of is diethyl carmozine. So when you give drug, after some times you go in peripheral blood, you take the blood and look for microfilaria. This test is called Hetrazan provocation test. This test is called Hetrazan provocation test. Then you do a Leishman stain and look for the filaria at the edge of the smear. So this is the life story of. So repeat my life story. The microfilaria filaria's life story. Life cycle occurs between man and the mosquito. Man and the mosquito. Man get infected by the bite of third stage larva. So they develop into adult worm. Their habitat is in the lymphatics and lymph nodes. Male and adult worm in the lymphatics and lymph nodes. The lymph channels get infected with and become lymphangitis, lymphadenitis, and whole lymph flow is blocked. So they get swollen leg, and leg looks like an elephant. That's why it's called as elephantiasis. It looks like elephantiasis. This microfilaria, which is released in the circulation, and when mosquito bites, it is taken up and it is developed into the mosquito in first stage, second stage, and third stage again. When it bites a man through saliva, it's injected back onto the man. This is the life cycle of the diagnosis is done by demonstration of microfilaria. Usually, they are seen in the midnight, and you have to take the smear in the after going to the ward at the in the night time. And sometimes they don't see, although sure of that it's filariasis. Then you have to give the drug diethyl carmozine, that is diethyl Hetrazan provocation test. Then after some time you take the peripheral smear and look for the microfilaria in the peripheral blood. So this is a Ucheraria bankruptcy. There is no difference between Ucheraria bankruptcy and malayi, but loaLoa goes to the eye and gives rise to blindness. Gives rise to blindness. Now see, Ucheraria bankruptcy most widely filarial parasite in human. 90% cases of lymphatic filariasis. Ucheraria, and these are the name of the two people. Ramdas and Gangadhar, if you have discovered, they are called uh, Gangadhar Ramdas filariasis. R. Ramdas Gangadhari, Uchirarea bankruptcy. Okay. Now, Uchirarea bankruptcy, nocturnal means it comes in the night. Microfilaria comes out in the bedtime. You have to go to the ward. There's a technician. Doctors will ask for the microfilaria. Go to that and get it. Except Pacific land, it is periodic. So this is a life cycle. So man get infected by the bite of the third stage larva. Usually go to the lymphatic and lymph channels. They get blocked, and microfilaria gets released. They are taken up by the mosquito, and in the mosquito again man get infected by the bite of the third stage larva. Okay, this is a life cycle. If you want to write down, you can write down. Is it clear? What? So mosquito takes the blood meal, ingests the microfilaria. This is the microfilaria. Okay, microfilaria. The adult worms are seen in the lymphatics, and they release in the peripheral circulation. It is taken up by the mosquito. Microfilaria head in the sheath and goes first stage larva, second stage larva, and third stage larva. Man get infected by the third stage larva, and they get develop into the lymphatics and lymph nodes. Again, the microfilaria are released. Again, life cycle. Is it clear? So repeat with me. Man and then get infected by the bite of that is a bite of Culex mosquito. Third stage larva is infected. Male and female adult worms are developed in the lymphatics and lymph nodes. Microfilaria are released into the circulation. Mosquito get infected by the bite of human blood, which contains microfilaria. Again, the life cycle continues. In the mosquito, first stage, second stage, third stage larva develops, and third stage is infected. Very simple, no? So during migration, there is a thickening of the lymphatic vessels, and due to the antigen and dead worms. This all happens in the lymphatics of the uh, migration of larva through the lymphatics, thickening of the vessels, and dead worms also accumulate in the lymphatics. And the secondary bacterial infection gives rise to lymphangitis, lymphadenitis, and sometimes fungal infection also, and due to fungal inflammatory reaction. These are all takes place in the lymphatic channels. Is it clear? So lymphatic and lymph channels get blocked. The leg gets swollen. It looks like an elephant. It's called as elephantiasis. So drug of choice for the treatment of elephantiasis, Hetrazan, diethylcarbamazine. That will come. Okay. Dead worm. So dead worm, what happens in the vessel? It gives rise to granulomatous lesions, fibrosis lymphatic vessels, and gives rise to obstruction of the lymph channels. One is this gives rise to granulomatous lesions, fibrosis of lymph channels, and lymphatic obstruction. It can occur anywhere between 5 and 30 years. Males are commonly affected because they go out, and most factor in female, I don't know, some resistance is seen in female. Incubation period 18 to 6 months. How to define incubation period? Entry of organism, development of clinical sign. Time gap between the entry of organism and parasite or development of clinical sign. 8 to 16 months. It gives rise to lymphatic filariasis. It goes to lungs. It gives rise to pulmonary eosinophilia, immune complex mediated reaction. So one is it mostly goes to lymphatics, In lung, it causes tropical eosinophilia. Lymphatic, tropical eosinophilia. Immune complex mediated. Immune complex mediated. So lymphatic filariasis, endemic, asymptomatic, acute filariasis, chronic filariasis, 4 stages. It occurs in a small area when it's endemic. Sometimes you carry the parasite without doing any harm. Sometimes acute lymphadenitis, and chronic. Symptomatic, endemic, acute, and chronic. 4 stages. Endemic, those people who are residing in the endemic area, they do not get infected. Microfilaria demonstrated in the blood, microscopic hematuria or proteinuria, dilated tortuous lymph nodes, filarial dance. Ultrasound showing the adult worm dancing in the scrotal lymphatics. So they are seen in the lymphatics. They do not have any complaints. High grade fever, lymphatic inflammation, transient edema. This is acute filariasis. Acute filariasis, they show high grade fever, lymphatic inflammation, and transient edema. Severe, you see the elephantiasis, swollen leg, and they go to the scrotum, gives rise to hydrocele. Enlargement of the scrotum is called as, why you are laughing? Hydrocele. Enlargement of scrotum is called hydrocele. And elephantiasis. Now, this lymphatics break down in the urine. It is called as chyluria. It gives rise to obstruction leading to edema, swollen leg, elephantiasis, elephantiasis, epididymitis, and funiculitis, and chyluria. Breaking of down of lymphatics in the urine. Urine looks like a milk. Urine looks like a milk. Uh, Also called as occult filariasis, hypersensitivity reaction with microfilaria. It's in the lung, okay? When microfilaria attack the lung, it is called as occult filariasis. Tropical pulmonary eosinophilia. Microfilaria are not detected in the blood. That is tropical pulmonary eosinophilia. It's called as occult filariasis. Tropical pulmonary eosinophilia, occult filariasis. Microfilaria is not seen in the peripheral smear. It is due to hypersensitivity reaction. So these are the points to be written in case of tropical pulmonary eosinophilia. Tropical pulmonary eosinophilia. Kidneys. It can give rise to nephrotic syndrome, nephrotic syndrome, And joints, filarial arthritis, filarial arthritis. Demonstration of thick and thin smear GIMSA by QBC examination, blood collected at night hours. It is called diethyl provocation test, Hetrazan provocation test. And Microfilaria bankrupti, tail tip is pointed and free of nuclei. So, pointed end. Sheathed. And you don't see nuclei, these are nuclei. At the end, they are free of nuclei. This is the microfilaria. Draw the diagram of microfilaria, it's very important. Sometimes they'll ask in your 5 marks question, there is a sheath, it is covered by sheath. That is head, cephalic is head end, the tail end is pointed, okay. So they have a genital pore, 1, 2, 3, 4, genital pore, then excretory pore, no nuclei in the tip, back end, and there is a nerve ring, cephalic space, and a sheath. There is a sheath and pointed tip. So remember, it is a sheath. There is no nuclei at the tip. You can share some four genital pores, one nerve ring, and no nuclei at the tip. 4 genital pore, one excretory pore, cephalic and tail end, head and tail end. Okay. If you write something like that, this is good enough to write in the examination. Some fancy diagram. But when you become a technician, you definitely see, because filariasis is still very common in coastal area. If you are coastal, Andhra has got a lot of coastal area, isn't it? Next to Korea, coastal area, maximum coastal area you see in Andhra Pradesh. Almost like 90, 100 kilometers of coastal area you have. Telangana do not have a coastal area. Okay, usually it is seen in coastal area. So this is seen in the peripheral smear. When you show a GIMSA stain, microfilaria in the peripheral blood. We have, I think, for the spotters, you can see the microfilaria. Antigen you can do by ELISA test, immunochromatography test, flow through assay, luciferase immunoprecipitation system. Imaging method, you can do ultrasound, PCR, molecular method. Other method is PCR, and Ig antibodies level is diethyl carmazine, that is Hetrazan, drug of a choice for treatment. It is given for 6 milligram per kg body weight for 12 days. 6 milligrams per kg body weight for 12 days. Or you can give albendazole twice daily for ivermectin. We tried this drug in COVID, 0.4 milligram single dose, but has no effect on its microfilaria side. It kills only microfilaria, not the adult one. Doxycycline also give for intracellular area, and for treating secondary infection, Streptococci, penicillin is given. Vector control, National Vector-Borne Disease Control Program, elimination of lymphatic filariasis. Anti-larval chemicals used as larvicidal, pyrethrum-based oil, pyroxene oil, organophosphorus and phenytoin imifos. This is a organophosphorus compound larvicides. Pyrethrum, DDT, hexachlorocyclohexane. It now become resistant. Thank you very much. So we have come to the fag end of parasitology also. Next, all classes what we'll do, we'll answer your question papers. We'll start all over again, virology, parasitology, and applied everything. By the time you go out, you should become a perfect lab technician in the microbiology. Thank you.